Lisa, a question I've often asked is what's the difference between PPE and face coverings?
Right. Well, the fundamental difference is that one protects the user and the other protects other people. So PPE is designed to protect the user. So, for example, a face mask would be used by people in clinical settings to prevent them from getting the virus through to themselves from a person who is suffering from it or for an asymptomatic carrier. Whereas a face covering is to protect other people from you. So, for example, you might be an asymptomatic carrier, and the face covering is to protect other people from you.
And again, we kind of fall into that false sense of security, don't we? Because I believe most people are wearing face coverings, but they think to protect themselves, not to protect others.
Yeah, that's the problem. And of course, the other thing is that the face covering becomes a surface as well. So it could in itself become contaminated. And one of the problems with wearing a face covering is we're not used to it, most of us. And that means that people are more likely to touch the face covering potentially with dirty hands, take them off, put them back on again. Where do you keep them when you're not wearing them? So all these things need to be considered very carefully. So if people are going to use a face covering, then they need to wash their hands before they put it on. Try to keep their hands away from it and not fiddle with it while they're on their journey, for example, if they're on the tube, and then take it off with washed hands. So you've got to have clean hands when you remove it as well, and then store it safely.
And then there's that extra hazard and risk, isn't there, if they're a food handler, that the very fact that if you've got a face mask on or PPE and you're adjusting it, they're very kind of difficult to wear over a long period of time. You start to touch the mouth and you start to touch the nose, and then you've got the possible transfer of Staphylococcus aureus straight onto the food, and we might actually inadvertently cause problems with food poisoning.
Exactly. And of course, one of the things that we must make sure that everyone is aware of is if they're already wearing PPE for their job, because that is what they need to wear, for example, in a dusty environment, then they should carry on using that PPE. So, anything that is done in relation to COVID-19 has to be done in relation to the risk assessment that's already been carried out for the normal work practices.
Another common anxiety amongst people is what PPE should be worn if you can't have effective social distancing. What's your view?
I think we have to go right back to the hierarchy of control and always think that, we've got to try to eliminate the risk by social distancing. And if that can't be done, then we move into thinking, are these people in a situation where they need some PPE because, for example, they have to work very closely next to someone who's potentially got coronavirus? And of course, we have to remember as well that anybody could be carrying coronavirus, even if they don't have any symptoms. So Public Health England has got some guidance on PPE for people who are working in care situations. And I think otherwise, what we've got to remember is putting on a face covering isn't going to protect just us. It's got to be, everybody's got to be using a face covering for that to be effective in a situation where you haven't got social distancing. So for now, if you can't have social distancing, then you really need to consider whether you can actually safely carry on with the work. And there are people putting in, for example, screens to help people at payment points, for example, or reception desks. But we need to think very carefully, if we can't control this, then should we actually proceed?
My biggest concern is actually the application of the PPE. And I know that this has to be done really professionally, it has to be put on properly. If somebody should be checking it at work, there's a checklist you can go to make sure that it's effective. And that's the bit I think that is missing from the equation. Everyone just says, well, put it on. But actually, there's not much information about how do you put it on, how you're wearing it properly, how do you check that it's on properly, how you're checking it throughout the day.
Absolutely. And of course, there is still a shortage of PPE, particularly face masks. So we need to really respect that and keep those for the people who genuinely can't help but be really close up to someone because of the nature of their job.
For me, I think one of the issues that's often overlooked is actually how to wear the PPE. A lot of people just think, well, you're given the PPE, that's it, that's the end of it. No, you've got to be trained to use it effectively, to make sure it's covering properly. And also you need somebody in the organisation to check that it actually looks okay and it meets all the kind of parameters that you put on to what good wearing of PPE is. So that to me is something to reinforce in the workplace. And I think the other reason why people are discouraging PPE generally is because of the shortage. And I think World Health Organization's advice on the wearing of PPE hasn't changed at all, which is, it's advising that it's essential for care workers and health workers, but other people, it's pushing towards the effective use of social distancing.
What PPE should EHPs wear when it's necessary to go into someone's home or business? What do you think, Sterling?
Well, that's a very common question that we're often asked, Lisa. And I always go back to the basics. Look, your local authority should be carrying out a risk assessment anyway in this, and PPE should be part of that hierarchy of health and safety that you're looking at. And it really should be the last resort. So the first question is, do you really have to go into that home? Secondly, do you go into that home after it's been left vacant for a while, in which case the virus won't be active at all? But certainly go to the local authority to get your risk assessment, and there are lots of guidances on the type that are available.
Yeah, and then the other thing is, of course, that there might be an emergency situation where a visit maybe is necessary to a food business for enforcement purposes, for example, or if there's a serious risk to public health. And I think the thing to do there again is to follow the risk assessment process, and that is to plan your journey, to speak to the food business operator in advance so that you know and you agree between each other how you're going to actually manage this safely. And it could be that you arrive at the premises and the food business operator leaves from the front door, you then go in and you're the only person in the premises while you do the inspection. And obviously you wash your hands first and you wash your hands before you come out. So it's really just sort of plotting the journey that you will take and think about the controls that are needed for that particular operation.
And always the most effective control is social distancing. So I always think as PPE is a backup if you can't maintain adequate social distancing.
Exactly. In fact, we've avoided the use of PPE altogether by doing that. Sterling, I often get asked this question: should members of the public and even food handlers be wearing single-use gloves?
I'm not a great fan of it, Lisa, because I think it can give people a false sense of security, and if they're not careful, they might lower their defences. I'm a great believer in regularly washing your hands with soap and water at the right times, and I'm a great believer in using hand sanitisers if a wash hand basin isn't available. What do you think?
I totally agree with you, Sterling, because I think the problem is that the single-use glove can just stay on the hand and people completely forget what they might have touched. So the other day I actually saw someone with a single-use glove rubbing their nose and then carrying on with whatever else they were doing. So it's really, in my opinion, something that's potentially very dangerous, actually.
And of course, the glove in itself can then, when it's being disposed, be a potential source of contamination.
So yeah, there've been a lot of problems with PPE being left around and discarded as rubbish. Right. Thank you very much, Sterling.